name's Olivia Laney, and I'm a 12th grader at Providence High School. And today I'm going to give a presentation on what is my senior exit stuff. My senior exit, as you can see, its topic is gay conversion therapy. And so I want to start off with a little bit of a disclaimer. The goal of my presentation is to be informative, and I do acknowledge, however, that there's going to be some bias in it because, you know, the nature of the senior exit is to be argumentative. And I would love to share my findings with you guys because I've done a ton of research and I wrote my paper, and I think this topic is really cool and really informative. So I'll ask that you guys keep an open mind and think about what I have to say, and I'll try and keep it as scientific as possible. So for those of you who have no idea and have never heard of this, gay conversion therapy is a form of psychological treatment that attempts to convert homosexual individuals to heterosexuality. And it's also called reparative therapy, and that's a little bit of an irony, and I'll talk about that later on in the presentation. Its overall goal is to instill heterosexual thoughts and tendencies in gays. So this is a very psychiatric, psychological approach on this subject. It began in the early 20th century, and in the 1960s and 1970s, it took a little bit of a hop forward. In 1964, the New York Academy of Medicine, which is a very prestigious organization back then, they proclaimed that homosexuality was an illness because it could be cured, and that's because homosexuals' brains are less mature than heterosexuals. Now that kind of sounds funny to say, and that's because there was no quantitative or pathological evidence supporting this. This was just pulled out of a hat somewhere. No experiments or necessarily numerical evidence was provided, and that's gonna be proved to be an issue later on. All right, so I'm gonna go over 5 different types, or the main 5 that I discovered in my findings, and the first one is called psychological counseling. Now, this type of counseling occurs in a one-on-one setting with the patient and the doctor present, and during counseling, patients are often told their mindsets caused by childhood neglect or trauma. And this is a quote from a man named Doug Upchurch. He was really interesting. I found out a lot about him and his experiences with conversion therapy in my research. And this is a quote from him that says, "One of the first things you learn is that it's your parents' fault is that you're gay." And that presents a lot of problems. And later on, he told his story and how that wedge lay in between him and his parents, and that caused a lot of damage to his family, which is never good when you're dealing with any kind of problem, or especially during middle school years. Another tactic that doctors often use in psychological counseling is called aversive conditioning, and that's the pairing of a negative stimulus, often pain, with an unwanted behavior. Now, the reason this is bad is because psychologists transform the therapy's goal from accepting oneself and how you are, and that's awesome, to be accepted by society, which is not so awesome. Rather than promoting self-acceptance, and therapy pressures gays to entirely remove this aspect from their personality, which in a lot of ways emphasizes it even more. Alright, the second is prescription medication. Now, there were so many different kinds of medications that I kind of tried to narrow it down to antidepressants. And these drugs are given to alter mindsets and divert patients from certain thoughts and tendencies. The 2 different kind of antidepressants I'd like to focus on are Zoloft and Abilify. And looking through my research, they had a whole bunch of different side effects. I don't know if anybody's parents take antidepressants, but these side effects ranged from migraines to suicidal tendencies. These were all over the board, and definitely not healthy at all in any way, shape, or form, especially for a medicine you're trying to take to feel better about yourself. I would never want to take a medicine that would make me feel bad about myself if I'm trying to feel better about myself. It didn't work. It confused me very much. And the reason this does not work is because homosexuality is not a disease. It was removed from the APA's list of mental disorders in 1973. And it can't be treated as a disease because it's, by definition, not. It hinders your progress even further when you take these medications, and rather than helping individuals accepting themselves, it causes even more problems. Alright, third type. I want to say my favorite type because it was intriguing, and this is definitely definitely not what I thought of when I thought of conversion therapy when I was choosing my topic. The goal of this therapy is to alter your biochemistry inside your body in the hopes of altering your behavior as well. And a lot of you, if you've taken like AP Psych, like we learn about these kinds of things and how chemicals interact with like the way you think and what you do, those kinds of things. And so what you would do if you went into a doctor's office is you would get periodical injections of either testosterone or estrogen, depending on your treatment plan. So let's say I'm a lesbian woman and I walk into a doctor's office and they would give me estrogen treatments, and that would make me look more feminine and more attractive and prettier with bigger lips and nicer hair, and that in the hopes of making me more attractive to males. Now it seems kind of, to me it seemed very backwards. It's definitely one of the most superficial treatments that I came across. It only produces surface changes a lot of times, and it cannot change how you identify yourself. Like, I'm still going to be the way I am no matter whether or not I have bigger lips or nicer hair, you know what I mean? Rather than encouraging like more profound acceptance and things like that, it was purely surface and purely superficial. Alright, the fourth one, and this one was my least favorite, that's for sure. This is called electroconvulsive therapy, or ECT treatments. And this is the practice of administering electric shock to treat deviant behavior. It's used for a lot of different things, and especially depression and things like that. What it does is it induces seizures through like electrical shock. So you would have a metal pad right here and a metal pad right here and a mouth guard in your mouth, and they would shock you. I don't know if any of you guys have had to read Sylvia Plath. For those of you in AP English, you'll definitely have to read The Bell Jar. But the main character in her book, she was undergoing treatments for mental disorder. And this is the description of her ECT treatment. It says, "Air crackling with blue light. I thought my bones would break and the sap fly out of me like a split plant." And to me, it doesn't necessarily sound pleasant, and that's probably an understatement. As you can imagine, like being hit by lightning, this has a lot of serious medical complications, ranging from vomiting to muscle spasms, all kinds of things. And the more critical of them being like even heart problems, like heart palpitations and brain injuries. For some cases, like I talked about earlier, how it can be used to treat mental or disorders like depression, and they might have some mild improvements, but these medical risks seriously outweigh any possible reorientation you could possibly have, especially if you're dealing with brain injury and heart palpitations. Nothing good is going to come out of that. Alright, if you have heard of conversion therapy, this is probably your first thought. This is what you thought of. This is the origin of Pray the Gay Away, and especially religious organizations like Westboro Baptist Church. These two were closely related when I was doing my research. This takes place in a group setting with religious leaders present, and a lot of times they ask for divine guidance through prayer and things like that. And even in some extreme cases, some exorcisms, and I'm sure that's in some more extreme form of religions. The big problem that I encountered here was that your treatment can be based off of views that vary from culture to culture and society to society. So in the Middle East, in Iran or Afghanistan, that treatment would be crazily different than what we see here. And that just, because the two things don't align and the treatments aren't the same, your effects are going to be negligible at best. A lot of times this induces insecurities, guilt, and frustration to reach that pure standard, which we know, like, me personally in my faith, I know there's not a pure standard. You be a good person, and there you go. It's immense pressure, and it's often psychologically damaging. Alright, this guy's name is Rick Kirby, and like Doug Upchurch, I read a lot about him, and it's a little bit of a bio, and he had a whole lot of, he had some issues, we can say, especially with like acceptance, and he was struggling very much, and he participated in programs from several different religious organizations, and he went to great lengths. He prayed, he fasted, and he went into this with his goal being to be accepted by society, which is never good, especially in these situations. But in the end, he concluded that it wasn't God who didn't love me, it was me who didn't love me. And I think, like, if you anything from this presentation, please remember that. Please, 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 please. Because I think that sums up a lot of what I think about when I think of my paper and my copious amounts of research, is that it's not about how others interpret you, it's not about if others love you, if God loves you, if these people love you, if those people love you. It's about whether or not you love yourself. And you're the one who has to live in your body, and you're the one who has to live your life. I think that's the most important. Alright, this is my to sum things up slide. Like I said earlier, in 1973, the APA, the American Psychological Association, removed homosexuality from its list of mental disorders. That means it can't be treated as a disease any longer, and it's incorrect to assume that these people are ill or like have a disease, which is totally not true, are a subgroup inferior to the rest of society. And this is a quote from a doctor named Richard Capiola. He lives in Naples, Florida, and I did a lot of close research, and I had several phone conversations at like midnight when I was trying to finish my paper up. And I really liked this quote out of all the things he told me. He said, "To cut something as distinguishing as sexuality out of a person and completely throw it away only cements it as part of the individual's personality." And to me that made a lot of sense, because if somebody completely random tells you you're not allowed to like red, that's it. The color red is the color of sin, and it's just not good. Nobody should like the color red. Well, I have a red jacket, and maybe I like this red jacket a lot. Maybe I should wear this red jacket because I feel comfortable in it. It's kind of like a tease, and I think the most important part to remember here is that it's not about cutting that part of you out. It's about accepting it and knowing how to deal with it, and moving on forward, and accepting that as part of your personality, and making that you. And I think conversion therapy, unlike acceptance and encouragement, which are also obviously the preferred methods here, they only induce guilt and shame and low self-esteem, and none of those things are good no matter who you are or where you're living. This is my favorite slide. Okay, do any of you watch Criminal Minds? Yeah, a couple of you? Well, they had an episode on A&E, and I was so excited about conversion therapy. And the episode is called Broken. And the more I watched the episode and I got to thinking about it, I realized it was an idiom off a play off the end of an idiom, should I say? Excuse me. Off of, if something isn't broken, don't fix it. And I think that's very ironic when it comes to the gay conversion therapy also being called reparative therapy, because there's nothing to repair. And this is a Twitter meme that I really liked. And I saved it to my computer when I was first beginning research, and I thought it went well with this presentation. It says, "Oh, you're afraid gays try to convert people to their own or sexual orientation? What kind of horrible people would do that?"